What is the most important nutrient for the breasts? It's iodine. Stick with me and I'm going to explain to you why. I'm Dr. Nathan Thompson with The Wellness Way, Yorkville, and let's talk about iodine and its role in breast health. There's an interesting article from the Journal of Cancer in 2017. The title of it is Changes in Dietary Iodine Explains Increasing Incidence of Breast Cancer with Distant Involvement of Metastasis in Young Women. One of the reasons why they wanted to look at this is because they looked at Japanese women who have a very low incidence of breast cancer. They also have a high amount of iodine consumption. But the interesting thing is that when Japanese women emigrated to a different country and adopted a Western diet, they saw their breast cancer start to go back up. So now they're looking at the role of iodine as far as the maintenance of good breast health. Who needs more iodine? Women who are having a cycle, women of childbearing age. And the reason why is iodine actually protects the breast tissue. Now, iodine deficiency is also associated with fibrocystic breast disease, which does play a role in breast cancer. But why are we seeing so many women who are considered deficient in iodine? Well, one of the reasons why is the standard American diet, or the Western diet, which is so deficient in iodine. Back in the 1970s, one of the things that they did is they removed iodine from bread and they replaced it with something even worse. And that is bromine, which is a suspected carcinogen. And if you look at the periodic table of elements, bromine and iodine are very chemically similar, which means that it's going to compete for uptake with iodine. This is why some other things like fluorine and chlorine are also very similar to iodine, and they will also compete for uptake within the thyroid gland and also compete for uptake within the breast tissue as well. One of the interesting things is that RDA for iodine is 150 micrograms, and that's just to avoid a goiter. But here's the problem: it's not for optimal health. And in fact, I've seen a lot of women who have gotten breast cancer, but they also were goiter free. So there's a big difference between RDA and what's going to be optimal for you. What are some of the biggest sources of iodine? Shellfish, fish, kelp, huge, eggs, organ meats, and yes, even some fruit, strawberries do contain iodine. Now, can you take supplemental iodine? Yes, you can. We're always want you to get it through diet first and foremost, but you can get a supplement that does contain iodine with some kelp in it as well. Now, just for some of these medical influencers, here's the thing. Taking some extra iodine is not going to make you make too much thyroid hormone. If you are making too much thyroid hormone, then there's like other things at play, meaning autoimmunity, or maybe there's some kind of pituitary tumor. These are some of the same people who say, I'm taking things in order to support my immune system, and like, well, you're going to boost your immune system into autoimmunity. Stay away from those people. They have no idea what they're talking about. You can watch the whole video of this on my YouTube page at Dr. Nathan Thompson. If you just go ahead and go to YouTube and look under our live playlist, you'll be able to see it, and make sure you watch the whole thing through, because I'll probably answer a lot of your questions on that video. I hope you find this useful. Make sure to like, follow, and share. Be well.